All right. Hello, everyone.
Hi, everyone.
Hey everyone.
This is our presentation about pubic lice, also known as crabs, among young adults. And this presentation will be specifically geared towards CSUN students living in the dorms. My name is Savannah Gourley. I am a CSUN resident assistant here, also known as an RA, and I live in Pacific Willow Hall here on the CSUN campus.
Hi everyone. I'm Iyam. I'm an RA and I live in Bayberry Hall on campus.
Hi, everyone. My name is Sarelle Janoian, and I am an RA as well, and I live in the Rose Crown Hall. So let's get into what is a pubic lice. Now, what is the difference between pubic lice and head lice? Well, right here, we have an image depicting a head lice and a pubic lice. And basically, a pubic lice is a little bit larger than a head lice. It has 6 legs, and its front 2 legs are claws, in which that's why pubic lice gets its nickname called crabs. So it is a type of parasite, and it feeds on human blood to survive, and it can live up to 24 hours. Now, if it fails to feed off of human blood, it's gonna take about 1 to 2 days until it dies off. It has about 2 phases, which is the young loose, which is the egg nits, and the adult loose, which is a parasite that causes itching. Now, we're gonna get into, in the next few slides, the details of the growth of the pubic lice. But most importantly, it is a secondary bacterial infection, scratching of the skin. So what does this mean? It means that you're gonna have about a blue or blackish pigmentation on your skin due to severe scratching. You're gonna feel irritable, you're gonna have fever-like feelings, and it also is a protrude, which means you're gonna have itching around the areas of pubic area and also the groin area. And we're gonna get into other areas in which it could actually move on to within your body. So the visual on pubic lice. So pubic lice depicted on this image right here, you could see that it attaches onto the hair shaft and it's gonna start crawling up. So nits, which is the first phase, it is the visual eggs, which you will see. And the parasite, once it hatches, it becomes a nymph and it's gonna start crawling and attaching onto pubic hair. And other areas that it can also spread to is eyelashes, eyebrows, beard, mustache, armpits, chest, and back hair. So getting into the growth of pubic lice. Now it has about 3 stages, but before we get into that, we have to understand that there is female and male pubic lice. And females tend to be a little bit more larger than the male pubic lice. And that is due to the fact that females approximately lay about 30 eggs within 3 to 4 weeks. And these eggs take about 6 to 10 days to attach to the hair shaft. And after it attaches to the hair shaft, what's going to occur is the eggs will hatch within a week and it becoming nymphs. And once the nymph attaches, it's going to take about 2 to 3 weeks to become a immature egg. So once it hatches, the nymph becomes an adult nymph, which then it's going to start its process of surviving on human blood, and it feeds on human blood, and it needs to feed on to grow. And as we mentioned previously before, if it fails to feed on it, it's going to take about 1 to 2 days until it dies. And most importantly, how can you see these? Well, you would take a magnifying glass and point into the areas that we listed previously, pubic, groin area, and take a magnifying glass and kind of see if you can see them. And what do they look like? Well, within this image right here, we can see that there's the egg-like image, the first nymph, second nymph, third nymph, and then becoming an adult nymph, which is going to be a larger size, 6 legs. First 2, they're going to have claw-like arms going for them, and then it's going to have about a big pigmentation of grayish coloring to it.
Thank you, Sarelle. All right, so based on talking about the severity of the issue of pubic lice, it's hard to say because there isn't a lot of data available. It's estimated that around 3 million cases are in the US every year, but because of that lack of information, we don't know exactly what the numbers are in the US and worldwide. So again, because there's such a lack of research, it's hard to know what co-infections arise with pubic lice and other STIs. We do know at least that scabies, which is not an STI, although it can be transmitted sexually, is often diagnosed alongside pubic lice, head lice, and body lice. It does have the same routes of transmission, as I stated, and same treatment, which is the pesticide shampoo that you'd be using for the pubic lice, and same recommendations that you get tested for other STIs, and that your sexual partners also receive treatment. Trichomoniasis is another STI, not a co-infection, but it is parasitic, as pubic lice is. It receives an antibacterial treatment. It can also be transmitted non-sexually, so like Sarelle said, on that hair shaft of yours, and scratching from the itching can lead to secondary bacterial infections.
All right, thank you, Edja. So now that you all have this sort of basic knowledge and understanding of what pubic lice, what it looks like, we want to know who is infected by pubic lice. And the answer to that, unfortunately, is everyone. So pubic lice affects every racial and ethnic group in the US, as well as every level of society. Like stated previously, unfortunately, there isn't a lot of data on pubic lice, so we can't really tell if there's disparities of whether more or certain groups get infected by pubic lice than others. However, the main thing that we do know is that sexually active adults are the most affected population of pubic lice. And so now that we know who gets infected with pubic lice, we can go into prevalence and incidence rates as well as at-risk populations. So the worldwide incident rate for pubic lice is about 2%. Now, incidence stands for new cases. So there's about 2% of new cases of pubic lice worldwide every year. Also, the groups that are most at risk are young adults, and that is due to the fact that they are least likely to implement safe sex practices. However, another overlooked sort of population that is also affected by pubic lice is older adults. And that's mostly because older adults get this sort of stigma that they don't have sex anymore when they get older, but that's not true. So older adults are another at-risk population that pubic lice can affect. Another reason why that the prevalence and incidence rates can be so low and there's a low level of reporting is because pubic lice can be treated with very common over-the-counter treatments. So usually what might happen is that someone realizes they have pubic lice, they go to their local drugstore or CVS, they get the over-the-counter treatment and they treat it at home and that's it. Whereas they don't really go to a clinic or a doctor and they get the treatment there. And at those doctor's offices or clinics, that's where they would report the case. So that might be a reason what could contribute to a low level of reporting. Also, the increased practice of removing hair might also contribute to low rates of prevalence and incidence. So for example, 70 to 80% of adults remove either all of their pubic hair or just some of it. And so when pubic lice don't have that sort of habitat or the hair, they can't thrive. Just like as Sarelle said, they don't have that habitat to grow in. So that could also contribute to why there's not a lot of data on pubic lice. So how is it transmitted? So there are several ways of transmission of pubic lice. One of the main ways is through sexual intercourse. The next way would actually be through personal and close contact. So pubic lice is an STI that can be transmitted through non-sexual acts. So, and then that would also include is touching personal items. And those can range anywhere in between towels, blankets, clothes, even things like pillowcases, rugs, any sort of like clothy fiber material is a way of how pubic lice can get to other people. And just to reiterate, pubic lice does not spread disease. Unlike other parasitic or maybe diseases that are spread by insects. Pubic lice does not spread disease. So the whole reason why we're doing this towards CSUN students is, like mentioned previously, pubic lice can be spread through personal items. And obviously when you're living through the CSUN dorms, you are close to a lot of people. Even just whether if it's your roommates or you have visitors coming to your dorms, you are in contact with a lot of items that do not belong to you. So we're going to go through some pictures of some dorms. Some dorms are from the CSUN campus, and we're going to look at examples of how pubic lice can be spread through that kind of environment. So this first photo here is an actual photo of a dorm here on the CSUN campus. I can't tell you which hall it is. I'm not quite too sure. But look at this photo. This is this great breeding ground for pubic lice. So we have this bedding here, even the pillowcases. Obviously, the people here are wearing clothes, even the rug on the floor. So let's say this girl sitting here at the desk writing something in her book has pubic lice, but maybe her roommate doesn't, and she decides to sit or lay on her roommate's bed. And just through that simple act, she can get pubic lice. And then on this next image, I don't believe this is in the CSUN dorms, but this is definitely in a dorm. This is a great breeding ground for pubic lice. I mean, look at all these towels. So we've all been there. You accidentally use your roommate's towel. You might not think it's a big deal. Well, it is, because that is a way that you can get pubic lice. Even if you have people coming over and they use your towel, just that simple act of touching it is a way that pubic lice can be spread. And then in this next image, this is also another image of a CSUN dorm here on campus. Look at this right here, all the bedding and pillowcases. They even have their towels next to or on their bed frames. So if they accidentally take one or share it, that is just the easy transmission of pubic lice. Or even look at the man sitting on the chair right here. He's leaning up near the towel. He doesn't even have to be living in that dorm to get pubic lice. And just through these images, you can just see how easily it can be spread, especially in the dorm environment. And so now that we've gone through all of those examples, I know what you're all thinking. How do I prevent pubic lice? Now, the 100% way to prevent crabs is to not have sexual contact or intimate contact, but we all know that's not a very forward-thinking way of how to prevent it. But we want to reiterate that condoms, although they are great at preventing several other STIs, they cannot prevent crabs. Just like mentioned before, you can lay in someone else's bed and you can get crabs just by that way. So with that information, some great ways to prevent pubic lice is do not share your blankets, towels, or clothes with other people. Even if it's just your roommate right next to you, do not share it. Do not lay in other people's beds. You don't know if other people have laid in other people's beds. Just avoid it at all costs. And let's say your roommate comes home one day and yeah, she says or he says, I have crabs. You want to wash all your belongings, and that would include your blankets, clothes, basically everything to try to prevent from you getting crabs.
All right. And if you do get crabs, which STIs are extremely common, they do happen, and you don't have to be afraid. There are many medications available to you. Permethrin is the first treatment that you would take, which is the lotion used for secondary skin infections caused by the scratching and skin breakdowns. Then there's Lindane, which is the pesticidal shampoo. The second treatment, which will kill the lice and the eggs. You use it for the entire 10-day cycle, or however long it says on the medication that you have in your hand. And that will be the correct way to go about treatment. Using both of them at the same time won't make it go away twice as fast. It won't kill the lice twice as hard. It's most likely not a safe thing for you to do. So the best thing to do is just follow the instructions and finish your treatment. And like we mentioned before, these medications are available over the counter at your local pharmacy, which does lead to a lot of people doing self-diagnosis, hopping on WebMD, seeing what do I do to get rid of these crabs? They head over to the store, they pick up the medicine, they never report it to a doctor. Maybe they don't follow the instructions as they're written on the medication. And when that happens, this can happen. Super lice. What's been happening is that doctors have been finding that body lice, hair lice, and pubic lice are becoming resistant to certain pesticidal treatments. And that's usually due to people not following the directions and not completing the treatment. So it's very important that you do that because you could be building an entirely new super species of lice.
Okay, so how can we help CSUN students to stay on track, to stay prevented, and to not have pubic lice? Well, looking at this one intervention, we found that they focus on a target population, and this was actually conducted in Singapore with adolescents, heterosexual adolescents between the ages of 16 to 19. And the participants were 351, and they were both young men and young women. And they focused on the STI clinic that adolescents would go to. And they did a 6-month follow up. And why are we mentioning this? Well, because this program that they had developed, they had focused on the health theory called self efficacy, in which this means that they focus on individual behaviors to help reduce the transmission of STIs among this population. Now, how does this help CSUN? Well, we have the CSUN Cloth Health Center. And at this health center, our students, they can go there and they could have STI classes for them. Now, even though STI, it has so many different diseases to it, but one important part is pubic lice is part of the STI family, in which we'll have students go there and they'll learn about treatment, prevention, how to stay away from this disease, which will benefit us as a CSUN population and for our students. And with that said, we would like to thank everyone for listening to our amazing discussion, our amazing RAs here, Savannah and Ajay. Thank you to everyone.
Yeah.
And we hope you will stay healthy and safe from pubic lice.
Thank you,
Thanks,
everyone.
everyone.